Friends, it's early in the morning. I can't sleep. What happened today has me particularly disturbed. So, whatever video or whatever I was planning to make about Trinidad, because sometimes on Sunday I like to release some video for some scenic place to see. No, not today. Today is this issue. Let me tell you, the public health system in Trinidad and Tobago, it sucks bad, and let me tell you why. Just imagine you have a relative, a loved one, a child, whomever it is, needs to see a doctor because they're in lots of pain. I mean, this is not just, oh, have a simple headache or a little ache here or there. No, they're in real pain. Could be something really serious. So you call the ambulance thinking that ambulance gonna get there fast, but no, it takes their time. Sweet time, as they say in Trinidad. When the ambulance eventually picks you up, they take you to the public hospital, and because you're coming in an ambulance, you're thinking, well, I will be seen soon enough because this is an emergency. But no, you reach there and you're told to sit down and wait. So you figure, well, probably they have emergency cases that came in before you. No, just regular cases of other people sitting down there, probably also told to wait. And you are seeing these people being taken one by one, and hours passing, not just 1 hour or 2 hours, no, 3, 4, 5 hours. You are sitting down there waiting. You came in by ambulance, don't forget that. So you see you are being passed over by these people, and you even see people coming in the hospital and being seen, and you are not being seen. Isn't that some sort of discrimination going on there? Dare I say maybe some racism? Yes, serious. This is like a malpractice thing going on here, and that's why it has me pissed enough to make this video. So you being passed over, it's going into wee hours of the morning now. You're waiting, you're asking nurses, you're asking doctors, you're begging, please, somebody need to see this person in pain. Nobody's seeing to you. And guess what? Early hours in the morning, all the nurses gone, all the doctors gone, you can't see nobody. You are there unattended after having come into the hospital by ambulance. Because it's early hours of the morning, you came there by ambulance, you now have to find your way to get to a private doctor, but where you're going to go to get a vehicle, to get transportation, you now have to sit down and wait even more for the sun to come up so that you could get a taxi or whatever to get to a private hospital. Now you might say, well, why you didn't go to the private hospital in the first instance? Well, you really want to, but the hour of the night, the day before, didn't warrant it. So we had to use the public service, much to our regret. And you might think, oh, this is a one-off thing JB complaining about. No, I'm a parent of special needs children, and I have been dealing with this CRAP for decades. I really don't want to use the public health system, but there's an immense cost attached when you have children with special needs. And although we have seen doctors and stuff in the private system, we have to use the public system at times. But sometimes you go there, you wait, nobody's seeing to you, nobody telling you anything. They change doctors all the time, so every time you go there you have to retell your case over and over. You feel like you're repeating yourself, and you feel too like you're not being heard, because you as a parent know fully well what your child is experiencing, but nobody takes you seriously. The other thing about it is that you go there, sometimes you make an appointment months in advance for something serious. 3, 4, 5 months you have to wait in order to see a doctor. And what is more is that when you do see the doctor, they say, you know what, this is our first world country, first world health system, sorry. But guess what? You have to go abroad to see about this, because we don't have the infrastructure, and we don't have the equipment, and we don't have the expertise and whatnot. But we have a big building around the savannah, multi-million dollar. I just don't understand that. How it is that you could build big buildings and do other things, but yet still not provide the equipment and the expertise that your child needs. Tell me if that makes any sense. So back to the original situation. So you haven't been seen. You came there by ambulance. You now have to go and rest somewhere until the sun come up to get a maxi or a taxi or whatever to take you to the other place. Is that how we want to be treated as citizens of this country? The health system in this country sucks so bad that you feel like you're begging. Now, yes, you do get one or two doctors, one or two nurses that do care. They are genuine with their job and the way that they want to help you. But that is isolated things. That's like the exception. That's like if you're lucky if you get somebody like that. Most of the times you're just a number. You're just somebody there, and they hope by running you around the system long enough, you will just get tired, fed up, and leave. But that ain't gonna work for everybody, because some people don't have a choice but to go into the public health system. And when you hear these speeches, they just when I listen to the television and I hear speeches about how much things being done and this done and that done, I feel sorry to throw up sometimes, because I know what the truth is. I don't know how you feel about this. I made a short video about it. I hope it goes viral, and I hope this message too also goes in the direction it should. Stop studying carnival, fete, music, and what you're going to eat and whatnot. These things in the day when your family member needs an ambulance or a doctor, and they have an emergency and they pain, you think you will be studying beach and carnival, what costume you're going to wear, what you're going to eat later? No, you will be studying how your family member going to get the best of care right away. Make these things important, Trinidad and Tobago. Please, tell me what you think in the comments area.